So JOI, through 29 physicians, takes care of the majority of high schools in our area. We've also been honored to take care of Jacksonville University, University of North Florida, in addition to taking care of the Jaguars since their inception in 1995. So it's a big part of our practice, being able to take care of athletes at all levels in the community.
At the beginning of my senior year, I was playing high school football, and I did a quarterback sneak and made one wrong cut, and I felt my knee tear from there.
I was just playing a pickup game of basketball with some friends one afternoon, and I was running and hyperextended it, and I heard a pop, and I think I knew that's when it was torn.
The anterior cruciate ligament can't be repaired. We have to reconstruct it by putting in a new ligament. So in both Kyle and Kevin's situation, we used what's called a bone patellar tendon bone autograft. That means taking a piece of their own bone, a tendon in between, and a piece of bone off the tibia, and using that to reconstruct the ACL. In order to reconstruct the ligament, I drill two holes, one in the tibia and one in the femur, and I'm able to arthroscopically, through small incisions with a camera, pull the new anterior cruciate ligament graft through one tunnel into the other tunnel, and I fix those bone blocks with screws. They're in rehabilitation starting 2 days after surgery, getting the motion back in their leg and also strengthening the muscles around the knee while the new ACL becomes part of their body.
It's tough in the beginning, just not being able to take care of yourself, and my brother had to drive me around, drive me to work and everything, so you have to be patient with it, and then as you progress, it gets better and better, and you're able to handle and do more.
I'm doing a lot better now. I'm about 6 weeks into physical therapy, so I can feel my knee feeling stronger, and I think I'm on my way.
I think the technical aspects of the procedure are a very small part in looking at the big picture for an athlete. It involves both mentally preparing yourself to go through a recovery process in addition to the physical aspects of recovering from a surgery. So it involves all of our staff, medical assistants, physician assistants, then the physical therapist, and the trainers. So we foster a team approach to getting athletes to return to play.
The rehab was tough, but the people at JOI made it so much easier on you. They made sure everything was okay. They would ice you after everything. They would make sure like your family's all right, and my mom would come back with me every session, and Andy would talk to us, and it was just a great experience.
My knee's doing good and playing basketball and football and working out, so it's definitely holding up.
So Kevin and Kyle both had a very positive attitude, and it made my job working with them extremely easy. They act like they're 6 months out of surgery when they're only 1 month out of surgery. They make me feel good about doing the surgery when I know it's really their body and their ability to push through. It's not an easy surgery to go through, and it's not an easy recovery process, but the both of them have been ideal patients in my practice.